My dear friend, this is your Dr.Pannirselvam on behalf of Grow Big Consultancy. Today, I think there is a challenge before us. That is, I would like to know from you that does a child matter? Child really matters. Children are going to be the future a milestone for us. So, what's happening during pandemic and childbirth and infant mortality? Just I went through some of the newspapers in UNICEF. So during pandemic in 2020, they said during pandemic it's going to be a boom of what? Babies. So they have forecasted are about 116 families. That is 116 million babies are going to give the title to families. So new babies are going to be 116 millions during pandemic. That is the announcement of UNICEF after their research studies. And India, how much? India was expected to be 20 million new babies. So new million babies, many million babies are born. Why what? Why what? Because pandemic, people will have to be at home and work is also at home. So everybody is at home. So it produces more and more babies. That's all conclusion. So now this novel idea of seeing many babies, okay, I think more babies. I think the data will show you that when you compare about 10 to 11 countries, India stands first. And what? Preterm babies. What do you mean preterm babies? The babies born little early. What do you mean little early? They are born 22 weeks, 27 weeks, 28 weeks, majority 27 weeks instead of 40 weeks. So mystery. So how could we manage? So there will be going to be a new natal department. So during pandemic, more babies, and out of more babies, you'll have preterm babies. So I just visited Stanley Hospital. Yes, it's true, more babies. Again, I asked, preterm babies. Yes, there are. Okay, it's a government hospital. Why don't you check our leading Apollo? Yes, we have. There are doctors, pediatricians agreed. 27 weeks babies are born. So now, what are the different, when they developed a labor pain, does it have labor pain? No more labor pain. There are different associations, different kind of associations connected with that labor. So to reduce your labor pain, is it possible to reduce the labor pain? Because now there is a news saying that the labor pain can't be reduced, even though they make an attempt to reduce the pain, can't be controlled even by taking some capsules or something like that. Labor pain cannot be controlled because why they want to control? They want to have delivery by some 39th week or 38th week or 40th week. It is no way possible, so baby has to be delivered. Okay, what are the different situations will occur? The premature babies, okay, they'll have a low weight. What are the problems they'll have? That is weight loss, hardly about 600 grams. They'll have breathing problems and heartbeat problems and paleness and weakness and failure to thrive, all sorts of problems. We do agree that every baby will have a kind of monitoring and careful care, but even then, these preterm babies will have to be only in the ICU, taking a maximum care from different departments. Will have to associate to go for not only pediatric, neonatal, and see that what is the infant mortality and cardiologist. Almost most of the physicians will have to attend to take a very, very close monitoring. So the babies will have to be seen in a different lab and a different kind of testing under the supervisions of medical practitioners and medical team. So now I think, what is the future? And now, why? Because when I just asked some of the psychologists, asking to know that why it has happened. During pandemic, when she is conceived, she will have two problems. One is, I think, the pandemic fear always threatening them. Number two, there is an insecurity how the baby is going to be, whether it will be free from all this ache or illness or the problems. So with that, I think, baby wanted to come out very fast instead of sleeping, resting in the womb. So now today, I think, doctors are fighting to save the preterm babies. So that's a challenge now. About 11 countries, data says that it's 3.5 million preterm babies we have in India. So what is going to be the challenge? It's a challenge for the medical practitioners to take care of their health, survival of the fittest. It is also a very big challenge, and also very expensive treatment to be given, and maximum care is adequately necessary. So this is a challenge which we have seen during pandemic, and especially in India and also in Tamil Nadu, we have seen practically that is how these babies have been suffering during especially the pandemic period. So I think, we pray God that is the children will have to be taken the correct treatment and again live longer. Preterm babies, I think, in Ahmedabad and other places we have seen 22nd week, 23rd week, it was little abnormal. It happened once or twice or few examples. Now it becomes, I think, when you call it as a 35 lakh, it's about 3.5 million. It's not a small number. And really the doctors or pediatricians are really fighting to safeguard and giving very good, adequate, sufficient precautionary treatment to save those children. So now this is a situation which every one of us will have to understand that how this preterm babies are born and what are the consequences they have, and how this will be the challenge for the medical practitioners as well as the pregnant women in the days to come. So this is the information which I feel happy to share with my audience. Thank you very much. Let us meet with other matters. So child matters very much nowadays, and they are going to be the pillar and milestone for our future. They are the architects to build the nations in the future. So the children will have to be safeguarded very well. Thank you.